Hi, I'm Joanna Wolf. I'm Vice President for Advancement and University Relations here at UHD. And we are here today to have our return to work town hall as we prepare to come back to campus on June the 1st. I know that many of you have questions about logistics and some of the campus operations, and we're going to try to answer as many of those questions as possible today during our conversation. But I want to be clear that we are presenting about summer 2021. We will come back with another town hall later in the summer to talk about the fall campus and what those operations will be like. So the format of our visit today is going to be Dr. Blanchard is going to make a few remarks. David Bradley is going to provide a PowerPoint, just a very short PowerPoint that answers some of the questions that we got during the registration period. And then I'll come back to moderate questions about our return to campus, beginning with some of those that were submitted when you registered and others that you can provide today during the Q&A at the bottom of your screen. So in order to keep us going right now, I am going to turn it over to Dr. Blanchard, and thank you so much for joining us. We have over 300 registrants for today's event, and we're glad to be able to share this information with all of you.
Hello, and welcome to all of you to today's Return to Campus Town Hall. I am Lauren Blanchard, President of the University of Houston Downtown, and I personally look forward to safely welcoming all of you, students, faculty, and staff, back to our campus starting in June. The decision to gradually come back to the university was made following very careful deliberation and after conversations with many campus and system stakeholders who have been working hard to make sure that the University of Houston Downtown remains a safe place to learn and obviously a safe place to work. If you've already visited campus over the past year, you will have noticed that many campus enhancements have already been put into place, designed to ensure your safety. And since I arrived on campus in March, I know additional modifications were implemented in preparation for your return. Today's event will address your concerns and provide an opportunity for you to ask questions about campus operations this summer. In fact, many of you have submitted questions already as part of the registration process. We have those logged in and we're ready to answer those questions for you today. And we will certainly, as you've just heard Ms. Wolf mention, that we'll host additional forums in August to begin plans for the fall. I'd like to again thank you for participating today. It really is important for us to be as fully informed as we possibly can be as we work toward the repopulation of our campus here at the University of Houston Downtown. And I look forward to many more productive and ongoing conversations on resuming on-campus classes and business operations here at our fine campus. As you heard earlier, next up will be Mr. David Bradley, our Chief Financial Officer here at the University of Houston Downtown, who will start us off with a presentation. Mr. Bradley.
Thank you, Dr. Blanchard. Hopefully I can be seen. We're not going to start my video now. I'm told we're going to stay with just my voice as we show this PowerPoint presentation. There we go. Thank you, Nick. Earlier, Joanna gave me credit for this presentation. Actually, others put it together. Big thank you to Cynthia Vargas, Eliza Alonso, and others. I'm very pleased to be participating today in this return to campus town hall. I'm looking forward to seeing folks again back on campus. I'm starting to run into old friends more and more showing up on campus. I look forward to more of that. This presentation is going to talk about how we've prepared the campus for people's return. So if we could go to the first slide, Nick. I'm going to talk about campus enhancements. And here's some photos for you. You can see on the photo to the left, elevator bank. It's kind of from a distance there, but the signage between the elevators is to let people know what the elevator etiquette is, and that's very important to provide that kind of information so people know what's expected of them as they're riding in the elevators. One example. To the right, you have just an example of how we've distanced, provided some spacing between seating areas in the library is what you're seeing there. Next slide, please, Nick. So I can just read through this very quickly. We have COVID signage that's been placed throughout campus. I will say this, we put a lot of COVID signage in place last spring as we thought we were going to be returning much earlier than this, but of course the virus had something to say about that. Dr. Blanchard has come in, and I will tell you, he has looked around and said, I want more signage. So we've actually enhanced the signage on campus. We've actually placed more hand sanitizing stations on campus at Dr. Blanchard's direction. So we thought we'd done a lot before, but we've done more in the last couple of months, as the president was saying. Classrooms, labs, computer labs, they've been spaced. They're currently at 50% capacity. Every other seat skipped. Mentioned the sanitizing wipes. We'll show a photo of those in a little bit. Office suites, plexiglass barriers have been placed in all kinds of locations around campus where necessary and where 6-foot spacing was not possible. Cleaning supplies have been provided to units across campus as needed. And in the public areas, every other seat's been blocked. Tables in the eating area, the dining area have also been spaced 6 feet apart. Nick? So there's an example of these sanitizing wipes that we have in all our instructional areas, classrooms and labs. And I was, telling Tim, our facilities director, that's probably something we want to leave in place even after the pandemic. It's sort of not a bad thing to have for people just to be able to get a sanitizing wipe, even as I say, post-pandemic. The middle picture is a faculty teaching station with plexiglass screen visible, so you can see we're providing that kind of a barrier for our instructors. And on the right, there's just an example of the kind of signage that you're seeing more and more around campus, just reminding people about masks and about social distancing and about what's expected of each of us as we return to campus. Next slide, Nick. Couple of things here. Hand-free door openers have been installed. There's a picture of that we'll see in just a moment. They're kind of foot things. The hand sanitizing stations located across campus. There's a picture of one. Hands-free, you can just step on the pedal at the bottom and it'll squirt out some hand sanitizer for you, so you don't have to touch anything. We continue to enhance, to clean the campus in an enhanced way in the evenings, and that'll ramp up more as we start to get more people back on campus. Air filters are routinely replaced, and we've upgraded, and I'll talk about that when we get to the Q&A. Some upgrades that have been made with to address indoor air quality in this pandemic situation. And again, air handlers have been upgraded. So next slide. There's an example of a student serving area. I think it's an IT area where it's an information desk where the plexiglass shields are in place for everyone's protection. On the photo to the right, upper photo is in the Welcome Center. You can see we're spacing the furniture out to keep the social distancing. And we're also putting signage there and asking folks, don't move the furniture. I know there's a tendency to want to do that on the part of the students, especially to pull chairs and things together, but we're discouraging that strongly until we get through this pandemic. And there's a table in the dining area there with lots of signage on it, reminding people about wearing masks and staying properly distanced. More signage on the left. The signage there at upper left is, you find that signage in all the restrooms, reminding everybody to do the 20-second hand wash, which we're still encouraging. Face covering, lots of signage around campus, reminding everybody that we still have a mask mandate in place here on campus. The center picture, I mentioned a moment ago, these hands-free door foot things that we put on the restroom doors. So if you don't want to touch the handle there, you can just use your foot to open the door. And that picture on the right is inside an elevator. So that's inside an elevator cab. Particular attention on that center picture. It reminds people that when you get on an elevator, we want it 4 at the max. Everyone go to a corner. Masks are required, and better not to engage in conversation while in those small spaces. Next slide, Nick. A little bit about university business services, particularly parking, and we'll get to dining in a moment. Parking, we have not a lot of people have been buying parking permits, obviously, over the last year, but we are going to be coming back starting June 1 in some decent numbers with the 3-day-a-week minimum for staff on campus. And so we expect to be selling parking permits for the summer. We'll continue with the 50% discount. And UHD has been, I think, pretty considerate on the parking when it comes to faculty and staff and students as well. We rebated, actually, we refunded a lot of parking when the pandemic first got started. And all the parking permits that we have sold during this time have been at a 50% discount. So you can see this chart shows that starting on June 1, you've only got 3 months left in the year. So the amount that would be charged would be 50% of what would normally be charged. So if you look at the fourth one down, the fourth line down, it says garage unreserved general. That's a $360 a year permit. So a 90 days or 1/4 of the year would be 1/4 of 360, which would be 90. But because we're providing a 50% discount, it's going to be $45 for the summer. And that can be set up as a payroll deduction at a pretty reasonable $15 a month. So again, we do need to start charging some parking fees again, and we'll be doing that starting June 1. Next slide, Nick. Dining services, there will not be dining services until folks return, or I think that's right. Yeah, May 14th through May 31st, there will be no dining services. We're kind of between spring and summer. On June 1, here's what we will have. Starbucks will be open Monday through Thursday, 8 to 3, and Friday, 8 to noon. They are encouraging mobile ordering, but they also have in-person ordering there as well. Burger 713, which is the grill, will be open Monday through Thursday for 2 hours from 11 to 1 for lunch, and closed on Fridays. Mobile ordering only. There'll be more information provided on how the mobile ordering will work. But that is the plan. Now, I will say, our food service partner, Chartwell's, they're very willing to adapt and adjust these hours, but it's going to depend on what the demand looks like. And so this is what we're starting out with. If it turns out that we need to expand those hours, they're happy to do it. Next slide. Focus on health and safety. Yes, hopefully a lot of you who are on this, participating in this town hall, had the opportunity to join us for the President's Vaccine Information Forums. We had 3 of them in the month of April. You can see who our guest speakers were. Just tremendous presentations, tremendous conversations. There was Q&A. We had a chance to ask questions of these extremely well-respected healthcare professionals, including Dr. Peter Hotez, who, if you watch much CNN or MSNBC, he's pretty regular on there. So it was great. And these are also available. They're recorded, and you can find them on YouTube. So, and I will say this, every one of them made a point about get vaccinated. They talked about how as soon as they were able to get the vaccination, they did so, and all their loved ones as well. So these gentlemen, that was a thrust of their presentations. They provided a lot of very valuable information, but they really stressed the importance and strongly recommended vaccinations for people. So, all right, we have free, on that subject of vaccinations, we've got some additional clinics. We had one, I think it was on April 12th, where Methodist Hospital was here. We had 460 members of the UHD community who got vaccinated here on campus. It was a tremendous success. We're going to do it again, this time partnering with HEB. You can see the dates coming up. We hope that if you haven't been vaccinated and you have a desire to get vaccinated, that you'll take advantage of these opportunities that are going to be provided to get a free COVID-19 vaccine right here on campus. And again, more information on that will be forthcoming in the weeks and months ahead. Free COVID-19 testing, starting on June 1. We'll have testing on campus, free testing. Curative is the company. They're going to set up a kiosk. It'll be located down beside the Student Life Center. You can pre-register, have your results emailed to you, get tested as often as you wish. And so we think that's going to be very helpful to be able to provide free COVID-19 testing for those who would like that. And guidelines for working on site. These were developed, I guess last spring, but the self-screening is very important. We're obviously asking everybody to self-screen every day, take a look at how you're feeling, and if necessary, take your temperature. But if you're sick, if you're having any kind of illness type symptoms, don't come to work. A mask is still required, and that'll be discussed, I think, probably more in the Q&A section. Stay at least 6 feet away from other people, and wash hands often, and avoid touching your face. I think we've all got those things memorized. So with that, I will now turn it back over to Joanna Wolf to kind of take us through the Q&A.
Okay, while we're all coming back on the screen here, I just want to point out that we've got quite a large group of people filling up your screen today to answer the questions that you've got. The VPs are here, the provost, a number of other leadership. I believe Jennifer Bloom from UH Legal is on the screen as well. So we're going to begin with some of the questions that you submitted during the registration period. We've sort of pared those down to take care of some repetitions through those. And I'll be directing them to specific people, but of course, others are free to chime in off of the screen. If you have something you want to add, just remember to unmute yourself. So I'm going to start with this question for Cynthia Vargas. Are vaccinations mandatory?
No, they're not. As a state agency, we do not require vaccines. However, we do support the State Department of Health's efforts to vaccinate Texans. As David mentioned, we've hosted a vaccine clinic on campus. We intend to do so throughout the next few weeks. And we encourage faculty, staff, students to not only get vaccinated themselves, but to also bring in family members that can be vaccinated. So please take advantage of that. Alternatively, you can go to your own doctor's office or to any of the other resources around the county. So for more information regarding our clinics, please just monitor the webpage and you'll be able to register off those links.
Great, thank you, Cynthia. Yvonne, I have a question for you. As a manager, do I have the discretion to make decisions about certain staff's return, considering the feasibility of social distancing? Unmute.
Sorry about that. Good afternoon, everybody, and thank you for joining us for today's town hall meeting. I'm Yvonne Montalbano, Vice President for Employment Services and Operations, and I'll gladly address your questions. So supervisors are encouraged to have a discussion with their employees about the upcoming return to campus, full transition to campus. As you all know, staff are required to be back on campus 3 days a week at minimum beginning June 1. With regards to social distancing, supervisors have been asked to work closely with emergency management and facilities management in conducting an assessment of a safety assessment of their respective workspaces to ensure that there are no safety gaps. And if there are any, they will be addressed before June the 1st.
Okay, thank you. And following up on that question, is there an alternative for staff members to choose to work from home, both as a precaution and for the sake of their own productivity?
So staff may continue working remotely no more than 2 days a week from June the 1st until July the 11th. After that, all staff will be required to be on campus, as I mentioned before, a minimum of 3 days a week beginning June the 1st, and then full-time, 40 hours a week on campus beginning July the 12th. We have made a commitment to everybody to communicate any transitions to coming back to campus at least 2 weeks in advance. We have communicated this weeks ago to ensure that staff have enough time to make the necessary arrangements to transition back to campus fully on a full-time basis beginning July the 12th. However, there are also always a couple of accommodations available. There is the Family Medical Leave Act, FMLA, and there is also the American with Disabilities Act accommodation. So if you feel that that may qualify for either, you can contact the benefits team at ESO.
Okay, thank you. David, this question is for you. How has UHD improved air quality in response to COVID-19 within the UHD campus? What kinds of air filters are being used? How often are they replaced or cleaned? Any information you can provide about that? Unmute yourself.
I knew I was going to do that. Sorry about that. Yeah, I've had lots of conversations with Tim Rylick, our AVP for Facilities Management, about indoor air quality. And when you talk about indoor air quality, there's really a couple of factors. One is how much outside air you're bringing into your building, and the other is the filtration. And we have taken steps to increase the amount of outside air, the outside air turnover, if you will. Tim is running our systems full 2 hours before the day really gets started and 2 hours afterwards to sort of, kind of cleanse the system, if you will. And we also are on the filtration side. The way they look at this with commercial filters, there's a rating system. It's called the MERV system, which is minimum efficiency reporting values. It's a whole range there, but you want to be in or what we target is to be in MERV 10 to MERV 13. I know I'm getting sort of technical here, but that has to do with the ability of the filter to pull small particles out of the air. And so we have, as I say, we try and stay in the 10 to 13 range, which means you're pulling 50 to 80% of the very small particles, like less than 1 micron, out of the air. Now, we also have added carbon filters in addition to the regular filters. So we're doing as much as we can on the filtration side. One of the things that Tim and I have talked about is, the coronavirus it's a respiratory virus. And so I know a lot of the focus early on was about touch surfaces and such, but if you think about what happens when I get into the doctor world here, but when you're breathing, you hear a lot about the droplets and the aerosols. Well, our air intakes and our air drops in all our office spaces and our classrooms and everywhere else are up at the ceiling or above the ceiling. And so it's very little possibility or very unlikely that there's much transmission through our ducts. And again, Tim and I were talking and we were saying that we've read a lot and we've seen a lot, watched a lot of reports on this stuff, but yet to see a case where there was a really compelling, irrefutable argument or case made that coronavirus was transmitted through ductwork. So we feel good that we've taken precautions with filtration, with increasing the outside air turnover, and we believe we're in pretty good shape when it comes to indoor air quality.
Okay, thank you. Cynthia, how will social distancing be enforced in the hallways? That's an area of concern for people.
Yeah, so you're going to see throughout our spaces, throughout our hallways, we have floor markers where people typically queue up and crowd around. You'll see that a lot around the register areas, cashier areas, registrar areas. But we haven't placed those everywhere. So there's a certain amount of personal responsibility here in that, don't give each other some space, don't crowd up. In those areas that are more common where people typically do crowd up, though, we have placed those floor markers. So please look for them and please stand on them if you do see them.
Okay. Yvonne, can you tell us about the flexible work schedule and what the process is for looking at that policy again?
So if you all remember, I sent out an email back sometime last month, explaining that the staff flexible workplace policy was tabled at the request of the Office of General Counsel. They needed to seek guidance from the Texas Attorney General's office because our proposed policy referenced the Texas government code that has to do with state employees and their place of work and the hours of work. So my assumption is that within the next 6 months or so, we should be able to hear from the Attorney General's office on an opinion, receive an opinion from the Attorney General's office regarding this subject.
Okay. And Cynthia, another question for you. Can you talk about how suites with only cubicles, no private offices, will be handled?
Yeah, really good question. It's been coming up a lot lately, and I definitely understand people's concern on that one. This has been a team effort between emergency management and facilities management. We're going through every single office space, suite, and workspace, and we're looking for those cubicle areas. So as you saw in the video and also in the photos, what we're doing is we're placing plexi barricades fairly high up to give people the safety bubble that they can be in. For very specifics as to what is happening in your office, please ask your supervisors, because we've been through most of the campus at this point. We're going back again, circling around to ensure that these items are in place to our satisfaction. And this will be an ongoing iterative process where we're constantly rechecking and monitoring to make sure that no gaps have been created or that nothing has been installed incorrectly. If you do see something that you're concerned about when you do come on campus, you'll know how to get a hold of me. Please don't hesitate to reach out so we can take care of it immediately.
Thank you. Yvonne, how will the mask mandate be enforced for faculty, staff, and students?
So many of us have been coming to campus now for months, and I can personally attest that our university community, those that have been coming to campus, they have been committed to following the protocols that have been established for safety in the workplace. And I truly don't believe that nobody would intentionally violate these protocols. However, if you encounter someone that is not wearing a mask or is not wearing a mask properly, where it covers their nose and their mouth, then you can, if you feel comfortable, you can approach them and ask them cordially to put on a mask. If you do not feel comfortable, then you can send an email to the coronavirus website and it will be addressed from there, especially if you know the name of the individual that was not wearing a mask.
So Cynthia, kind of following up on that, when do you think we'll be able to take off the masks? A lot of people are vaccinated, so they're just wondering when that might happen.
Yeah, so as of right now, we continue to require masks in our public spaces indoors. There are situations where you can remove your mask even right now. And this will also continue to be implemented, in June when you all return. So if you're in your private office and you're by yourself, you can remove your mask. If you're in a cubicle area, if it is enclosed in that safety bubble that we were talking about, and you're in there by yourself working quietly, turned in towards your computer, you'll be able to take your mask off at times if you feel comfortable that if you want to take a little breather. But once you go into public areas, we still, out of an abundance of caution, want to continue that mask use, allow a few more folks in the region to continue getting vaccinated. So those public areas, whether it's lobbies, elevators, stairwells, please continue to wear your mask in those areas. We've got designated eating areas where you can go and remove your mask so that you can eat comfortably. So the cafeteria area is going to be one of those areas. You can always go outdoors to get a breather. Wearing a mask all day is certainly difficult. So go outside during your breaks or have your lunch out there. If you can maintain that 6-foot distancing from other people outdoors, you certainly can remove your mask if you're going to exercise out there. But otherwise, indoors, again, those public areas, hang in there just a little bit longer with us. We are monitoring that. We are monitoring local conditions, but we feel that continued mask use at this point is still helpful to bringing down the numbers in the local Houston area. So hang in there with us, guys. We're almost there.
David, can you talk about how UHD is using the CARES money it's received over the past year?
Sure. That's a very good question because, people are seeing these very large amounts being reported and they're real. How is that money being used? Well, there's been several installments, if you will, or allocations of federal relief, COVID relief. The first was back last spring. It was the CARES Act, and the university received roughly $10 million through the CARES Act. And about half of that was designated as emergency educational aid for students. And so it was pushed out to students, and the other half was considered basically institutional, to be used for other institutional needs. We ended up using a million of that and used it as educational aid. So we actually added another $1 million to the educational aid to the benefit of our students. So that number went to really closer to $6 million. The $4 million that was used as institutional, we used about $2.2 million to refund ourselves for summer fees that were waived. We waived 4 or 5 fees last summer for our students, and we were able to use CARES Act money to reimburse ourselves for those waived fees. Same with some of the parking refunds that we provided, about $195,000 worth of parking refunds. We were able to recover that using CARES Act money. Technology was a big consumer of CARES Act money. As you would expect, COVID has really driven technology costs up. About 1.2 million of that institutional money from the CARES Act went towards technology. Facilities spent about 250,000 getting the campus ready, with all the things that needed to be done. You saw many of those slides earlier with the plexiglass and the products and the sanitizing wipes and other things, and the labor and costs associated with getting everything ready. And so that's basically where the CARES Act money went. It's all been spent. Now, the second allocation was the CARES supplement, and that was passed right at the end of the calendar year, very late December. And UHD received approximately 19 million from the CARES supplement. Again, there was 5 million that was for educational aid for students. And Daniel Villanueva and his enrollment management group, they're in the process of allocating that 5 million out to our students this summer and into next fall. The 14 million that is basically the institutional portion, we're going to, and working with the president and the provost on that right now, we're going to use about 6 million of that again as recovering lost income, lost revenue. We got a ruling from the general counsel's office that we're going to be able to reimburse ourselves for the 5% general revenue reduction that was imposed by the state last year. That's about $2.6 million for UHD. We're also reimbursing ourselves for some waived fees in the fall and spring, particularly the university center fee, which we waived because students weren't able to use the Student Life Center, which is primarily what the center fee is for. We also are in the process of figuring out how much we can reimburse ourselves for lost parking revenue and several other, and continuing ed also. So about 6 to 7 million of that 14 million will end up being recovered revenue, lost revenue that we're recovering. The remainder, we've got some expenditures that have been made, again, on the IT side as we build out these flex classrooms and take other steps that are kind of driven by the pandemic. We're doing some HVAC work. I mentioned earlier the things that we're doing to improve indoor air quality with some air handlers and such. Daniel Villanueva, Daniel needed some money for some temporary employees, so that was done. The provost has provided a list. He's worked with his deans and others. They've got a list of about $3 million that's being evaluated right now to see how much of that can be done. All told, it looks like about 12 million of the 14 million is loosely committed. That still leaves a couple million that's out there. Now, I will say, people sometimes forget that this is one-time money. I know there can be frustration when people see these dollar amounts and say, hey, why aren't we adding more permanent positions or providing salary increases? It just can't be used for that purpose. We also have another, this doesn't get into the American Rescue Plan that was passed in the Biden administration. And that's another amount of money that's coming to us that we haven't received yet, but we will receive in the coming months. That is like $30 million. And about 15 million of that is for student assistance, once again, emergency aid for students. And there's another 16 million that will be for institutional needs. And we really haven't gotten into, and we haven't had much discussion about that yet. But that's sort of where we are with the federal relief money. I hope that helps.
Okay, thank you. Cynthia, can you talk about how the COVID cases are trending at UHD and what the cumulative numbers are?
Yeah, so currently we have one active case that originated off campus. That person never came on campus during their infectious period. They're getting close to being at the end of their isolation period. Total, we've had 267 cases reported since the start of the pandemic. These numbers are generated by the UHD contact tracing team. And as they acquire new cases and begin to investigate new cases, that information populates onto the UHD COVID-19 website. So if you're ever curious, just go to that website and look for the tab that says UHD cases, or just Google it, Google UHD COVID cases, and we pop up immediately, and you can monitor that. And in fact, there's a breakdown where you can look, and it's actually giving you those numbers per week of new cases that came in, any cases that were on campus, and then cases that have recovered or resolved. And what we've seen over the last year and a half is that we really just follow the same trend that the local region does. So as the region starts to spike, we see additional cases here. And as the region decreases, our cases decrease as well. And that's exactly what we're seeing.
Great, thank you. So I'm going to move to the questions that have been submitted through the Q&A here. We've got about 25 questions here. So, and we have a hard stop, I believe, at 3 o'clock. So just kind of keep that in mind as we're answering these questions. So this first question, why does UHD need to return full-time in July, and UH is returning, their returning date is later in the summer? This says August. I'm not sure that's accurate, but regardless, why is it not the same between the two institutions? And Dr. Blanchard and Dr. Link, I think I'm going to ask the two of you to address that question, or one of you to address that question.
I'll be happy to start off, President Blanchard, and then if you want to add to it, please feel free. So we gave a great deal of consideration to this gradual return to full campus engagement and consulted, of course, as many metrics as we could, and had a lot of discussions about this. And so we settled on June 1st for a variety of reasons, which I will not enumerate here, but I will say that it did allow for the local K-12 school year to end, for people to have time to arrange for childcare and so forth. The July 12th date that we selected allows for us to have 4 weeks, a month, to get ready for the launch of our fall semester. And we felt that there was value to this institution, to having staff, faculty, folks re-engaged with campus, working in their unit on a full-time basis in order to have that lead time so that when school does open, classes begin, new faculty are arriving, students are arriving back on campus, that the facilities are completely ready, that we are ready, and we're at 100%. A second thing that I'll just add to that, we have a lot of events that begin to happen, particularly in terms of recruitment, registration, advisement, a lot of student-centric kind of activities that historically have been very effective late in the summer when we're able to have those on campus. And so by bringing folks back in mid-July, that gives people in student affairs and enrollment management and other student-facing units a chance to begin to engage with students to help propel those efforts forward. So that was just a little bit, very quickly, some of the thinking that went into the June 1st and the July 12th dates.
Dr. Blanchard, did you want to add anything to that, or?
No, I mean, I completely concur with Dr. Link in that it's the runway piece, right? It's making sure that we're creating the runway to ensure our sense of complete readiness by the time the campus becomes more populated than what it's been for the past year. And so that's the main reason. And, you know, I know that we tend to compare ourselves not only with the University of Houston, but also with the Clear Lake campus, as well as the Victoria campus. And, you know, we're alike in lots of ways and different in others. I know for a fact that, for instance, at the UH campus, that they are more populated now in terms of the number of courses that are being offered, that have been offered, I should say, this spring semester, as well as the number of staff and faculty who have been working on campus than certainly we have. But bottom line is that, you know, this isn't a comparative kind of process that we're using. We're really working on trying to make sure that we're creating the healthiest and safest environment here to ensure that we can get repopulated, and more importantly, making sure that our learning environment is going to be at utmost where it needs to be to best accommodate our faculty, our staff, and our students. And so we look forward to having all of our staff members back. We certainly look forward as well to having our faculty and our students back as well, and working very diligently to ensure that that can be done as smoothly as possible.
Thank you. Yvonne, there was a question about when, is there a deadline for when supervisors need to set June 3rd return schedule, the schedule for people returning to campus that week?
Well, supervisors are not required to submit anything to ESL, but I would encourage supervisors to do the planning ASAP. Because number one, they need to engage, as I mentioned before, their staff, so the staff can plan accordingly, what 3 days a week they'll be on campus. And also number two, they need to ensure, supervisors need to ensure that their offices, their departments are staffed Monday through Friday, 8 to 5. So in planning who's coming back and what days a week, they need to keep that in mind. So again, as soon as possible.
Thank you. Daniel, can you tell us whether or not the virtual lobbies will continue to be available for summer and fall?
Yes, Joanna, they will continue to be open throughout the summer, fall, and in enrollment management specifically, we don't have any plans for them to ever go away, as we have found some success with that. That does mean that there's additional work and we have to reconsider how we operate. But no, those virtual lobbies will sustain, will be open, as well as the advising center lobbies. As I've visited with many of the advising centers, they too will remain open with the virtual lobbies.
Thank you. There's a question about whether or not there's a process for faculty or staff who wake up with flu-like symptoms and are scheduled to be on campus or to teach in person that day. Yvonne, I think you or Cynthia perhaps want to answer that question.
Well, when it comes to faculty, I would like to defer to Dr. Lake to answer that question. But for staff, they need to contact their supervisor, follow the protocol established by the supervisor on how to contact them, and not come to campus, take a sick day.
Yeah, and I'll just add to that any faculty member who wakes up with flu-like symptoms, like anyone else on campus, should write to UHD COVID-19 at uhd.edu immediately, just to put emergency management on notice that you're feeling a little bit under the weather, and that way, in case there is a need for contact tracing, we can begin those processes. If there is a need for extra sanitization of an area, we can begin those processes immediately. Of course, regardless of COVID, if someone wakes up and is feeling under the weather, your health is paramount to us, and we certainly want you to make sure that you have an opportunity to get well so that you can be at full strength, whether you are conducting a meeting or attending to other service or research activities or teaching a class. As with any situation, whether it's COVID related or not, if an instructor is unable to meet with the class in person because of illness, please reach out to your department chair and let them know. Please communicate in a timely fashion with your students and let them know how the work will be handled in your absence.
Thank you. David, related to cleaning of campus, how often will public areas be cleaned?
Okay. Boy, I wish Tim was here. He's not available today. I'll do my best to answer that one. I know we've been engaging in enhanced cleaning across campus. The public spaces, we were fogging those areas with a microbial kind of product back in the spring. And I believe we've continued to do that every 90 days. But again, I'm going to get back with you. It's a product that has a 90-day effectiveness. And so they were fogging the common areas, hallways, restrooms, all those public spaces every 90 days. But again, that's just how I'm remembering it. I'll need to get with Tim to actually confirm that.
Yvonne, are student workers expected to return to campus as well, or can they work remotely?
No, student workers are expected to come back to campus as well.
And will all student-facing offices begin to offer on-site assistance, Daniel?
Most of them have already been offering on-site assistance. They currently are now. And so as of June 1st, we'll continue that pattern, and all student-facing offices will continue to be open. There may be a caveat where you have to ring a bell or dial a number and they'll come from the back office, but all offices that are student-facing have staff in them and are ready to serve students as of now.
Thank you. If fully vaccinated, will face shields be enough when teaching in classrooms, or will masks continue to be required? I think- Okay, Eric, I'm sorry.
Or were you passing it off to Cynthia?
Either one of you, you can toss a coin.
All right, I'll start us off, and then Cynthia, I'll turn it over to the expert. So I'm going to start by saying that our request is that whenever possible, people continue, at least for the time being, to wear a mask. That is the default position, and we still do encourage mask wearing, whatever activities you are engaged in on campus. Obviously, as Cynthia already talked a little bit earlier, if you are in an office by yourself and you are in a safe environment, and you can certainly take a break from your mask during those times. But whenever you are engaging in a public space with others, particularly in cases where social distancing is not ideal, we are asking that everyone continue to wear a mask. Having said that, if it is impractical for teaching face-to-face to be conducted with a mask on for some reason, there are limited opportunities for some exceptions to the mask wearing policy, but a couple caveats would have to be true. There would have to be social distancing between the instructor and the student. So there would have to be a gap in between the instructor and the students. And there would need to be some kind of a barrier or a plexiglass barrier or something like that between the instructor and the students. So under those limited circumstances, it may be possible to teach safely without a mask on. But again, the default position is that we ask people to wear their masks if at all possible to do so. And with that, I'm going to turn it over to the expert, Cynthia.
So I'd like to add that what Dr. Link just described is what we've done over the last semester. And I'd like to remind everybody that there is a lot of new information coming out of the CDC. And the situation is pretty dynamic when it comes to relaxation of mask use, particularly when you have some vaccinated folks. We're still 3.5 months away from the start of the fall semester. So please be patient with us as we allow time for that new information to come in and allow us time to assess it as well. There is a possibility, I can't tell you one way or the other at this point, but there's a possibility that there'll be changes to mask use on campus and face covering on campus by the time the fall comes in. So please continue to monitor that COVID-19 webpage, because that's where you will first see the information over the summer months. As we approach the fall semester, we will obviously hold another informational session so that we can bring you up to date with the latest information.
Thank you. Yvonne, I'm going to start this question with you. You may prefer to ask someone else to cover it, but many people on campus have worked remotely since last March. So why is it that now we need to look at the legalities of doing what we've done for the last 14 months, particularly since this remote work has been effective?
So at the onset of the pandemic, the president had could proclaim a state of emergency, allowing employees to work from home. That is no longer the case. So, with vaccinations increasing and all the measures, the health and safety measures that have been taken on campus. So at this point, we need to seek an opinion from the Texas Attorney General's office. Jennifer may be able to elaborate on this.
Sure, happy to. It's a great question. And it seems like we've all lived a couple of lifetimes between since March of 2020. There have been numerous executive orders from Governor Abbott. There's been an ongoing declaration of a disaster in Texas due to COVID. And there's been seems like a constant pivoting and changing as needed to different guidance from both federal as well as state health officials. So all of that said, there's a Texas government code provision that talks about the hours that state employees work and the place where they work. And so as a general rule, that government code provision says it's going to be 8 to 5, and it's going to be at the regular office that the agency conducts work. And so with the pandemic and the different emergency orders and stay-at-home orders, there's been flexibility given to state agencies like UHD as a state institution to do what's necessary to keep the workforce and students safe. With flexible workplace policies and other policies about remote work, they are forward-looking into a time that we all look forward to post-pandemic, or at least post-disaster. And so that's where there's uncertainty about how the governor's office and the state auditor's office that deals with a lot of the human resources issues for state agencies, how they want business to be continue to be conducted. And are we falling back onto the government code provision and have limited exceptions? Or are these kind of more sweeping policies like a flexible workplace policy? Is that permissible? So it does seem like there's been a lot of time at home and virtual working, and we've all, I think, been, at least on some level, pleasantly surprised that it's gone as smoothly in a lot of ways as it has. But being a state agency and falling under not only the governor's orders, but state law complicates things and makes it so that getting an opinion is a good idea, as opposed to diving in and having to then pull things back. And we're in the same boat as other state institutions, other state universities in Texas. And so in getting guidance from the Attorney General's office, as well as keeping communications open with our sister institutions, it puts us in firm footing.
Thank you. If individual staff do not feel comfortable having students in their office spaces, can they work on campus but provide student services virtually? Daniel, I think between you and Yvonne, I'm going to ask you to take that.
Yeah, so what we had originally planned for in the last summer and early fall, and we can continue the discussion with this, is to have an area dedicated to where individuals who have small offices can work in a large conference room with tables spread out. I think, Liza, at the time it was like 10 to 15 feet with plexiglass. We opened it for a short time. We had very little reception from prospective and current students to use that, so we haven't used it again. But we could resurrect that conversation with the events, our events team, and see if there is a location at which some offices, particularly the advising offices, are really small, that right now they might be okay individually with the door shut, but when a student walks in, and a student may have, you know, a special case where they don't wear a mask or whatever, or they are, but it's just a tight fit, that we could have some sort of schedule provided where advisors could rotate in an area which would have more openness to it and some filtration and things of that nature. So I'll add that to my list, but certainly I think that's something we can continue to look at.
Thank you.
Exactly, and let me elaborate for a minute, Joanna. That's has been our advice from ESO to supervisors when they have approached us, that perhaps identify a conference room that can be scheduled, maybe half an hour at a time by different offices and different staff whenever they have to meet with other staff or with students. We do that in ESO. We've been working, we've had people in benefits and comp and so on for quite a few months. And if they don't feel comfortable working with or meeting with an employee in their office, they schedule the conference room to meet with them there to ensure social distancing.
Thank you. Daniel, I think this is probably for you as well. Are students being given a free summer class due to the pandemic?
No, it is not due to the pandemic, but we are offering all students, undergraduate students, who enroll in one class for summer, one course free. We did last year some financial aid available, but this year with our calculations and the additional care funds, we felt that we had enough funding available to offer every undergraduate student one course free. And that is not exclusive to the pandemic. It is something that, depending on institutional aid, we hope to continue, but it is happening this year. And it's not a direct result of the pandemic, although it's happening during it. And so one could imagine that, but it's not all classes. It's one class free for all undergraduate students.
Okay, thank you. Is there any consideration of some sort of training or recommendations, talking points for people dealing with persons who simply refuse to wear a mask and perhaps are threatening?
So I'll take this one. So I do want to point out that our current COVID face covering protocols actually covers this question. And so within that, you'll see that you're asked to have the person, put on a mask, ask them kindly to put on a mask. And if there's one available, there's a department available, they're going to have one available most likely. And so you can point that person into that direction to get that COVID mask. That face covering, excuse me. But if they are making a threat of violence, then just like any other situation, you'll want to call the UHD police and have them removed from campus. And you want to report that if that's a student, you'll want to report them through the student conduct incident report form so that it becomes a student conduct matter. And if it's an employee, I imagine that you would contact Yvonne directly for that.
Okay, thank you. Are individuals required to work 8 hours on 3 days, or could they do some combination of half days? Yvonne?
So beginning June 1, it will be 3 8-hour days on campus. And then again, beginning July the 12th, it will be 40 hours on campus. There is a policy that deals with flex schedules. You can talk to your supervisor about the possibility of maybe a compressed work week beginning July the 12th. But for between June 1st through July 11th, you will be required to be on campus 3 days a week, 8 hours, if you're a full-time employee, full-time staff.
Okay. Cynthia, can you talk about, and you've already referenced this a little bit, but there are several questions here asking about sort of revisiting plans as we move into the fall, both related to COVID, the impact of flu in combination with COVID, perhaps relaxing requirements around plexiglass and masks. I'm sort of combining some questions together, but if you could just sort of address the reevaluation that might be needed as we move into the fall.
Yeah, absolutely. The information that we're providing you right now is very specific to the next few months. So for the summer months, we recognize that things are actually dynamically changing. So we ask that you be patient. You know, in the past, we haven't had to ask this level of patience before, and we know that. But the information is so coming in so quickly that we need time to allow that to come on in. And we are taking that into account as we formulate, new protocols. So for the fall right now, although we have this general umbrella of safety, that is subject to change depending on the conditions, right? We are very much trending to ongoing improved conditions. Dr. Hotez and Dr. Peirce, in addition to numerous other medical professionals, are saying that they're looking for an even more significant drop-off of cases locally in July. But again, we're waiting for July to make sure that that does happen. And as that does happen, then we will consult with those folks that we can make those necessary changes here on campus, to whether it's to continue the ongoing mitigation strategies, or if it warrants it, to slowly start to relax those things and normalize the campus. So again, folks, I understand the frustration of wanting those definite answers now, but there's still so much time. 3 months during COVID is a lot of time. So please continue to be patient. Please continue to monitor CDC and other trusted medical authorities. And ask me those questions directly as we get a little closer. But know that, again, as we approach the fall semester, we will absolutely be having additional informational sessions with you to bring you the latest information. So thanks again for your patience, but hang in there just a little bit longer with us.
So there is a question that's suggesting that that UHD, of course, is state funded, and that other state institutions are taking a more cautious approach, and ask why we are not focusing more on the advice from trained public health and medical officials. But I think what I hear you saying is that that is exactly the approach we are taking.
We are. We're talking to not only several medical officials, but very high-ranking medical officials. We literally had them on forums, and you're absolutely welcome to go back and review those. Dr. Purse is the Chief Medical Officer for the City of Houston. We had Dr. Hotez, who is a national level authority. You see him regularly on CNN. He and his team are actually involved in the development of a new vaccine that they're looking to push out to underdeveloped countries in the near future. So we are having conversations with these folks. We virtually meet with state officials, medical officials on a weekly basis. And we also use the UH medical director, Dr. Span, as a resource as well. So those conversations are and do continue and do take place. They're going to continue to take place. Whoever asked that, I suspect you have a very specific thing in mind. So, please, if you would, reach out to me offline or afterwards, and maybe we can continue this discussion, because I really would like to reassure you and the community that these are very ongoing conversations, and we absolutely take those medical directives and guidance into consideration as we formulate our strategies here on campus.
I see that there are several questions here about compensation for staff and faculty who have worked at home over this period of time. I know that question was brought to cabinet earlier this week, and I don't know that we are prepared to address that question today. So I'm just sort of not ignoring them, but skipping over them at the time, unless somebody wants to step up. I believe that question will be answered shortly. Regarding, and I'm going to make this our last question regarding the impact of the pandemic on our enrollment and whether or not we've been able to meet our goals in this situation. Daniel, I'm sorry, can you address that one?
Sure. Yeah, we throughout the pandemic have met and exceeded all of our enrollment targets and expectations, largely due to the collaborative work of the faculty who have pivoted the courses online and kept the integrity of the courses while delivering the content. The advisors for advising students in a virtual environment, making it possible to be able to get those advising appointments and advice on how and what to take, and enrollment management from admissions to financial aid, transitioning all of our services in the registrar's office, all online, to be able to help students and largely because of IT support of already having tools and things in place for us to pivot immediately. So we are on our 5th semester of consecutive enrollment growth and hope that summer will be our 6th and fall will be our 7th, and we'll end with 15,600 students for fall.
Great, thank you, Dana. I think that largely covers most of the questions we've gotten. Dr. Blanchard, did you want to say a few words before we turn off? I know we're a few minutes just over time.
Yes, and I won't be long. First of all, I just want to thank all of you for participating. Those obviously in the hot seats relative to the responses that were very thoughtfully provided to the questions. but also in terms of all of you. As I see here was over 300 individuals who participated in today's meeting. I encourage you to keep coming with questions. And we want to make sure that we are being as responsive as possible, even with the questions that we have seen here that we were not able to get to. We have a running list of questions and answers related to COVID-19, and that those will be added to the list and we'll provide responses there. But as you began this, Ms. Wolf, you made it very clear that there will be other opportunities for town halls, for more questions to come, especially as we get closer and closer to the fall semester. And we look forward to an equal or greater number of participants in those conversations as well. I'm very encouraged, not only by all of what I'm hearing by our local and national public health experts, but also encouraged by the team of people that I have the great fortune of working with every day here to ensure that this place is and will continue to be a very healthy and safe learning environment. So thank you all very much for your participation today.
Great, thank you very much. And we will be back with another town hall later in the summer before the fall semester, and hope we have lots of good news to share then. Thanks so much for joining us today.
Thank you.